Welcome to One Cosmetic, one of Sydney's world-class cosmetic surgery clinics. Behind every treatment we perform, there's a real person with their own unique story. We're going to take you along with them on their journey to personal transformation and outstanding results.
Hey guys, my name is Claire Parker and I'm a personal trainer here at Zadi Training as well as a patient of One Cosmetic. Today, I'm going to guide you through the One Cosmetic do's and don'ts of getting back into training post-surgery. One of the most frequently asked questions at One Cosmetic is how soon can I get back into training after surgery? I know for me, when I had my breast augmentation surgery, it was a huge consideration and something I was keen as to get back into training as soon as possible. Having plastic surgery will put a halt on your training just for a little while you're still recovering. So today, we're going to take you through week by week our recommended levels of training intensity from day 1 post-surgery all the way up to week 12 post-surgery. It's important to make sure that you are carefully following the post-op instructions provided by One Cosmetic, but also really important to listen to your body. Everybody is different and everyone's healing timeline will progress at a different rate. So don't feel any obligation to rush back into anything that feels too much too soon. The main concern that any surgeons have with regards to returning to exercise post-surgery is any high impact movements that are going to cause that up and down motion, including running and jumping. Exercising too soon or too aggressively post-surgery can slow down your healing process. If you are a patient who is having a breast augmentation surgery, it's important to note that the majority of breast implants are placed partly under the pec muscle. So it's very important to let this muscle heal before returning to training. Following breast augmentation surgery, your body is naturally going to develop a capsule surrounding the breast implant, which is very important for holding it in place and keeping it undetectable under the skin. All right, guys, let's get started. In your first 24 hours to 7 days following your surgery, it's really important to just take things slow, allow your body to heal, and really focus on rest and recovery. Make sure you're keeping those fluids up and getting plenty of sleep. We have a couple of exercises that we recommend you do a few times a day in that first week post-surgery that are going to aid in giving your pec muscle a little stretch and also allowing your lungs to return to full capacity following being under anesthetic. The One Cosmetic team recommend taking a nice deep breath in and hold for 2 to 4 seconds a couple of times a day. This is going to aid in expanding your lungs and your ribs. A couple of times a day, we want to get in 10 to 15 shoulder rolls, up, down, forwards, backwards, and making circles as large as you can. This is going to help increase your shoulder mobility and make you feel a little bit more relaxed. In the first week to 2 weeks post your surgery is usually when people start returning to work. But of course, as always, it's very important to listen to your body, take it easy, and don't rush into anything. At this stage, we recommend going for some light walks. 3 to 4 weeks post-surgery, you can start incorporating some body-weighted, lower body movements into your training regime. But it's important to remember not to be lifting anything heavier than 5 kilos until at least 6 weeks post-surgery. There are heaps of different variations of body weight squats and lunges that you can incorporate. Also, adding resistance bands is a great way of increasing difficulty of your exercises without adding any load. Weeks 5 to 6, we can start incorporating some more movements into our exercise regime. Things like Pilates, yoga, anything low impact. We can at this stage also start incorporating a little bit of our core into our workouts. Now, it's important to note that with any breast surgery, the incisions underneath the breasts do tie in with that shape of your abdominal muscles. So anything, again, too much stretching or pulling back and forward can interfere with those stitches. So just focusing on isometric movements, bracing the core, but again, nothing too high impact, no running or jumping at this stage. So So, week 7 to 11 in your healing journey, we can start adding again a little bit more load into our movements, and we can also start incorporating a little bit more of our upper body into our training regime. Of course, it is important that we are not doing any high contact sports or anything too heavy on the weights. At this stage, you can start incorporating some light jogging if, of course, it feels comfortable. With regards to your upper body movements, let's avoid anything using the pectoral region or anything overhead. But if you want to start incorporating some bicep curls, some of your triceps, a little bit of your upper back, then this is all good to go at this stage. Guys, you've made it week 12 and beyond. You're pretty much all healed up and good to go with all of the sports and recreational activities that you loved prior to your surgery. You can get back into your contact sports, heavy weight lifting, and all of those movements in the gym that you were doing previous to surgery. The One Cosmetic team would like to really emphasize that even after 12 weeks post-surgery, any training to change the size or shape of your pec muscles will also affect the appearance of your implants and can cause them to separate. So it's recommended to avoid too much training of your chest. Alright guys, that's it. Hopefully this video has been really helpful on guiding you guys on how to get back into your training regime. Of course, if you do have any questions, contact the One Cosmetic team.
Thanks for watching. Visit our website at onecosmetic.com for more information, and don't forget to like, comment and subscribe. See you next time.